All right, let's play detective for a little bit. Today, we're going to try and solve a really common medical mystery. I'm calling it the case of the missing energy. We're going to uncover the clues, line up the usual suspects, and hopefully crack the case on a condition that affects literally millions of people.
So, let me ask you, have you ever just felt completely drained? Like you got a full night's sleep, but you're just dragging yourself through the day? Maybe you get winded just walking up a single flight of stairs, or you feel kind of weak and dizzy and you have no idea why. Well, that's our crime scene. These frustrating feelings that just tell you something is off. And for this whole energy theft situation, we have a prime suspect. It's a really common, but often overlooked condition called anemia. And today, we're going to put it right under the microscope.
Okay, so to really understand the culprit, first we have to identify the victim. What exactly is going on inside our bodies when anemia decides to show up?
I want you to think of your body like this huge, bustling city. It's working 24/7, right? And just like any big city, it needs a constant supply of fuel to keep all the lights on and keep everything running. For our bodies, that absolutely essential fuel is oxygen.
So how does that fuel get delivered to every single neighborhood, to your brain, your muscles, all your organs? Well, that's the job of your red blood cells. Just imagine them as this massive fleet of delivery trucks, constantly picking up oxygen from your lungs and rushing it out to wherever it's needed.
And that, right there, is the heart of the problem. Anemia is basically a massive logistical failure. It means your city's delivery fleet is either too small or maybe the trucks themselves are kind of faulty. Either way, you just don't have enough healthy red blood cells to get the job done. The whole city starts to have power outages, and that's exactly where that fatigue and weakness comes from.
All right, so now we know what's happening. The investigation has to move to the why. Why is the delivery fleet failing? Well, it turns out there are three main culprits, three primary suspects that we need to line up.
So, anemia usually happens in one of three ways. First up, we've got suspect number 1, blood loss. This is when the city is losing its delivery trucks faster than it can build new ones. Think stomach ulcers or heavy periods. Then there's suspect number 2, decreased production. This means the factory itself, your bone marrow, isn't making enough trucks, usually because it's missing key materials like iron or vitamin B12. And our last suspect, number 3, increased destruction. This is when something is actively wrecking the trucks and taking them off the road, which we see in things like sickle cell anemia or certain infections.
Now, every good culprit leaves behind clues, right? For anemia, those clues are the symptoms our bodies send out like little distress signals. Let's take a look at the evidence.
Okay, so here are the telltale signs. That constant tiredness and weakness, that's the most obvious one. Your city is just running on low power. Pale skin, well, without enough of those red blood cells, you kind of lose that healthy color. Feeling short of breath or having a really fast heartbeat, that's your body desperately trying to pump what little oxygen it has around your body faster. Then there's dizziness, headaches, brittle nails, even yellowish skin sometimes. See, these aren't random. They are all direct results of that oxygen shortage we were just talking about.
Okay, we've identified the victim, we've lined up the suspects, and we've examined all the clues. Now for the most important part of any investigation, actually cracking the case. How do we find the right solution?
And listen, this right here is the number 1 most important rule in solving this whole mystery. You have to know which suspect is responsible. Just saying I have anemia is like a detective showing up and saying a crime happened here. You need to know who did it and why, because any treatment that doesn't address the specific cause is, well, it's just incomplete.
And this is exactly why finding the right suspect is so critical. If the problem is an iron deficiency, the solution is to get more raw materials to the factory, so iron-rich foods and supplements. If it's a vitamin B12 issue, you're going to need different supplements. If some other chronic disease is the real villain, then you have to focus on managing that. And in really severe cases, you might just need a direct delivery of new trucks, a blood transfusion. The solution always has to fit the crime.
So, if there's just one thing you take away from our little investigation today, please let it be this. It doesn't matter if it's a nutritional thing, or blood loss, or some underlying disease, the very first most critical step to solving the case of your missing energy is always working with a doctor to find that root cause.
And that brings our investigation to a close. So the last question isn't for me, it's for you. After everything we've uncovered today, I just want you to think, what clues is your body giving you? Thanks for joining me. Stay curious and stay healthy.